Supraventricular tachycardia. SVT. What is SVT? Supraventricular tachycardia is a condition where the heart suddenly beats much faster than normal. Originates above the ventricles in the atria or AV node. Heart rate typically exceeds 150 to 250 beats per minute. Episodes may start and stop suddenly, paroxysmal. Cardiac conduction system, overview. SA node, natural pacemaker. Initiates electrical impulses. Impulses travel to AV node, then to bundle of his, bundle branches, and Purkinje fibers. SVT involves abnormal electrical pathways causing rapid heart rhythm. Types of SVT. Atrioventricular nodal reentrant tachycardia, AVNRT most common type, reentry circuit forms within or near the AV node. Atrioventricular reentrant tachycardia, AVRT involves an accessory pathway, example, WPW syndrome. Atrial tachycardia originates in ectopic atrial foci. ECG features of SVT. 1. Heart rate. Usually 150 to 250 beats per minute, BPM. 2. Rhythm. Regular rhythm. 3. P waves. Often absent or buried in the QRS complex. Sometimes appear just before or after the QRS as pseudo-R in V1 or pseudo-S waves in inferior leads. 4. QRS complex. Narrow, less than 120 milliseconds, if no aberrancy. May be wide if there is aberrant conduction or pre-existing bundle branch block. 5. PR interval. Not measurable or shortened. 6. Onset and termination. Sudden onset and termination, often paroxysmal. Causes and risk factors, congenital heart defects. Excessive caffeine or alcohol. Emotional stress, anxiety. Hypothyroidism. Stimulants, example, cocaine. Certain medications. Electrolyte imbalances. Smoking. Signs and symptoms, rapid heart rate, palpitations. Lightheadedness or dizziness. Chest pain or discomfort. Shortness of breath. Fatigue. Fainting, syncope. Anxiety or panic sensations. Diagnostic tests. Electrocardiogram, ECG identifies rhythm. Holter monitor, 24 to 48-hour ECG recording. Event recorder, for infrequent episodes. Electrophysiology study, EPS invasive test to identify electrical pathways. Management and treatment. Non-pharmacological, vagal maneuvers, example, Valsalva, carotid sinus massage. Pharmacological, adenosine, short-acting AV node blocker. Beta blockers or calcium channel blockers. Antiarrhythmic drugs in resistant cases. Procedural, catheter ablation, destroys abnormal pathway, often curative. Electrical cardioversion, in emergencies, nursing care plan. Assessment, monitor heart rate, rhythm, oxygen saturation, and blood pressure. Intervention, administer medications, initiate vagal maneuvers as prescribed. Patient education, lifestyle modifications, medication adherence, when to seek. Emergency care. Emotional support, address anxiety related to symptoms. Prognosis and prevention. Prognosis is generally good with proper treatment. Ablation is successful in 90 to 95% of cases. Preventive tips, avoid stimulants. Manage stress. Regular follow-up with a cardiologist.